It is just a great pleasure to have our colleagues here from Emory University talking about their new mapping system for HIV/AIDS in different communities across the United States. And we're very, very honored that they've chosen to feature Charlotte together with Denver as two cities that they're launching this database for this year. One of the most important things about health data and health statistics is making those data accessible for the public, putting those data into formats where people can understand them and where people can really capture the significant need that we have about many of these conditions. And I think that AIDSVu is just a brilliant example of that. So I'm very excited to have them here and have them walk through this morning a little bit about this methodology and about some of the approaches that they think can be helpful to us here in Charlotte.
We know that certain areas of cities and areas of the country are more highly impacted than others, but there's something about the images that really changes the conversation that we have about how HIV is impacting our communities. So in this map, it actually gives us a visualization of the core of the city being the most highly impacted area in Charlotte. And also this mapping process and the detailed data behind here actually allows us to look at different populations. So for instance, if we needed to have information about the rate of HIV infection among Black and African American persons in the city, you can see that those maps are available here. So it's trying to take all that complex, very rich data and put it into the hands of people that can really make a difference.
We know that if you get on treatment, that you can live as long as anybody else, and more importantly, you won't be able to transmit your virus to others as easily. So we have, again, hope that we can actually end the epidemic of HIV. We know what to do. The third strategy is that once we identify people that need care, we need to get them in care and keep them there. There are many challenges that people live with in addition to their HIV virus. This is still a virus that causes stigma. And so people are at times still concerned about accessing testing or telling people that care about them, including their physician, that they think they might have HIV. This is still a disease that's very expensive to treat unless we have programs such as the Ryan White program that will assist people in getting care. But data shows, and that really is where our power is that if we get people into care, for example, in Jacqueline Climore's program, which is also your program, statewide assistance for drugs, which we provide medications to people that struggle, 78+% of the people on those medications are virally suppressed. So we know what to do. That is the hope.